This morning for our series on the money, we are looking at how you can save on your healthcare expenses as we head into the new year, especially with open enrollment happening right now. NBC's senior business correspondent Christine Romans is here to break down everything you need to know. Good morning.
Good morning. Christine.
So I got the big envelope in the mail, open enrollment. I put it on the counter. I should probably dust it off at some point. What are some things we should know? Maybe some changes going into this year.
So in general, healthcare prices are rising, I'm sorry to report. So that means the decisions we make about our healthcare are really, really important. If you get your healthcare through the Affordable Care Act, that's millions of you, 24 million of you. Look at the estimated increase in your subsidies, your premiums rather this next year. This is what the whole government shutdown is about. They're fighting over these higher costs for the Affordable Care Act.
114%.
Yeah, it's a big number. So really do your homework there and take a look at that. That could change. Maybe Congress will figure something out before the end of the year, but that's what you need to brace for there. If you get your health care, though, through your employer, which is what most of us do, those prices are probably expected to rise as well, maybe 6.5%. That's the biggest premium increase, in about 15 years. So that's about 165 million of us. Again, reminder why it's so important to make the right health care costs or choices, because these costs are rising. And if you're on Medicare, open enrollment has already started for you. That's 69 million people. You have a prescription drug maximum out of pocket rises to $2,100. These are new features last couple of years. And also on 10 really important drugs, there are the government negotiated lower prices there. So you'll see some changes in Medicare, but they're really good calculators and helpful tools online for people in Medicare. So if you're going through the open enrollment process there, take a good look at that and see what next year will hold for you.
Give us a Christine Romans checklist. What are some particular things we need to be paying attention to?
So flex now. What you do right now is really going to help you save money on healthcare, because you still have last year's insurance choices that you can max. So if you've already hit your deductible for your family, go out there, make some more appointments. If you've been putting off a procedure, do that. If you need to go to the dermatologist, do that. If you need to get braces or go to the eye doctor for a new prescription, do all of that. Once you've hit the deductible, all the healthcare spending after that is good. It's cheap money. So basically do that, and then dust off your envelope and vet all of the different plans for next year. Look at what you've spent on healthcare this year and figure out what's best for your family next year. And don't forget to adjust your pre-tax account contributions for healthcare, retirement. I always say this. Make sure you're putting the max in the 401k, but you also can use pre-tax money, and you should be, for your healthcare expenses. So really dust up that and make sure you got that money put away.
Okay, so you mentioned adjusting about what you're putting into pre-tax. Well, tell us a little more about that. So
pre-tax money is so important to build your wealth, right? Rich people use health savings accounts. What are those? That's different than the FSA. It's the HSA. If you're in a high deductible health care plan, you may qualify for this. This is basically an investment account that stays with you when you move employers. You put your pre-tax dollars away, it grows tax-free, and later on...
And it rolls over.
And when you are old someday, that's how you're going to pay for your health expenses, and you're going to grow it. So it's like a free investment account.
I wish I discovered it sooner, quick.
Yeah, it's really... If you have the option to do it, you should do that.
And you can also use it to pay caregivers, too, right?
Look at this guy. Look at this guy.
Wow.
He's the chief business correspondent over here. The flexible spending account, you kind of use it or lose it. You can roll over a little bit of the money if you want, but that's also pre-tax dollars. That belongs with your employer. This one is really exciting because you can pay for a lot of different things. You can pay for braces. You can pay for a really nice humidifier for your bedroom if for flu and cold season. There are a lot of different things you can do. You can pay for, if your doctor signs off on it, you can get massages and use pre-tax dollars. You can go to the chiropractor. You can buy sunscreen, maybe braces. Even the Aura Ring, we checked if you want to get one of these fancy little health monitoring tools, a blood pressure cuff, all of those things you can pay with pre-tax dollars.
Pre-tax.
And we only have a few, couple months left, so this is the time to be going out there and making sure you spend that money.
It's good. Yeah, this is great.
Yeah.
Thank you. Do you like this time of year? Do you love open enrollment?
I love this time of year. I love to just flex the money I've already saved,
You love this almost as much as you love tax season.
It's a close second.
Christine, thank you.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC, or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.